is recognized for his works and accomplishments as a clinician and medical doctor, professor and academician, and also a scientist. Much of his efforts is focused on bioengineering, and he specializes in spine surgery, instrument design, bone stabilization devices, rehabilitation engineering, and many more. Currently, he is a full professor in University of the Philippines College of Medicine, head of the Biomechanical Laboratory in UP-Philippines General Hospital, and the leader of the Biomedical Engineering Program under the National Institute of Health. His group pioneered the use of 3D printing in medicine in the country. So ladies and gentlemen, I'm very happy to introduce to you our next speaker who will be sharing us 3D printing for biomedical applications, the Philippine experience, spine and joint surgery specialist at the UP-PGH, Dr. Rafael C. Bundok.
In our center is where Filipinos come to have their treatment for all the diseases, and in this center we see almost everything that will ail a patient or a Filipino patient. Number one. And number two is a training center. It's a university hospital of the University of the Philippines. It is where we train doctors to be future healers of the country. So what we do in 3D printing came out of necessity. There are barriers in medicine that we have to circumvent, that we have to go over in order to be able to treat our patients. That's why we have to pioneer 3D printing in our hospital in 2012 to 2014. Okay? So let me present to you some of these things. 3D printing for biomedical application of the Philippine experience. Okay. This is the human body. We can compare it to a very sophisticated complex machine, like for example a Ferrari, which is very beautiful, hydraulics and everything. But even a beautiful machine like this can have an impact injury and become like this when an injury happens. It so happens that the human body can also be destroyed in so many ways. Okay? It can be destroyed by trauma. It can be damaged by infection and cancer. It can be damaged by congenital anomalies. And all of us here, I see many young faces, you'll not be young forever, you'll turn old. The first time I had to work with the DOST, I was a very young guy. That was way back in 1992. Now it's 2019. I'm already 57 years old and still stuck with DOST. Okay? But I love it. Okay? So this is an example of what we treat every day in the emergency room because of vehicular accidents, motorcycle accidents. And this is an example of how infection can cut off your fingers because of dry gangrene. This is another example of neoplasm, a bone tumor, that can grow to something like this. And of course, for us to be able to save the life of the patient, we have to cut off the limb. Okay? And then, all of us will turn old. As you can see from the X-ray on the other side, you have a degenerative changes over the hip, and we have to replace it with hip replacement. And then, we have children who are born with congenital anomalies, and we have to do something for them to be able to go into the mainstream of society. Okay? And then, the biggest problem that we have are the things that we have to put our body. This is a contact lens. Okay? That is a stent that you put in heart to save you from heart attack. This is something that you place in your breast to make it perky. Okay? This is something you use over your ears for you to be able to hear. And this is something that you use over your teeth so that you can eat very well. And then of course, something that will keep you alive, an artificial heart. All of these are produced by subtractive manufacturing. Okay? Now, there are medical barriers that are unresolved by subtractive manufacturing. What are these barriers? Can additive manufacturing help us resolve these barriers? Let me just point out to you some of the barriers because these are barriers that are very important for us in 3D printing so that we can be able to help our patients live longer and be better. Now, there are four. One is accurate biologic modeling. Secondly will be patient-specific instrumentation. And then the capability to create the perfect tissue or artificial organ. And lastly, tailored treatment, proposition, or modality for our patients. If you're a doctor and you are presented with such a patient, that's a injury, what kind of implant are you going to use? It can be off the market, it can be off the shelf. It has to be tailored fit for you to be able to treat them. You cannot choose an implant for this very tall lady on that very small lady. Or can you use a very small implant on a very tall patient? It has to be tailored fit for the patient. Agree? Okay. Now, you can only do that if you have perfect anatomical modeling. Anatomical modeling before was very hard. All you can do is to observe and measure the x-rays. You cannot touch it. But nowadays, by using DICOM images and converting to STL files, you can come up with very good biological modeling. Okay, now what are DICOM images? DICOM images is called Digital Imaging and Communication Medicine. It is our basic language in medicine. How do you get that? When you have an X-ray taken, when you have a CT scan taken, when you have an MRI taken, all your images are in DICOM files. Now, the biggest challenge is how to convert this DICOM files into something that is 3D printable. Now, the DICOM image has to be read by a reader that can convert the DICOM image to an STL file. Okay. So, before, we don't have these readers. And if you're going to buy it, it's very, very expensive. Now, they come free applications over the internet. Okay? So, with these DICOM images and DICOM reader, we can now very well convert a DICOM image to an STL file. What's an STL file? We have been talking about 3D printing the whole day, but nobody mentioned what an STL file is. An STL file means stereolithography file or a standard tessellation language file. STL file is the universal language of 3D printing. Anything that you can convert into an STL file is going to be printable. Okay? Now, this is an example of a jaw that we converted to STL file, and using a desktop 3D printer, this is in my study room, I was able to print that jaw. And that jaw is an exact replica of the jaw of the patient. You measure it from end to end, it's an exact replica of my patient's jaw. Now I have a perfect model that I can touch and that I can practice on before doing surgery on my patient. Before, all I had to do is to look at the computer, try to plan out my surgery, look at the X-ray, measure the X-ray, and that's it. It's one-dimensional. But now I have something in my hand even before I do surgery on my patients. Okay? Now, 3D biomodeling is usually industry-based. Before, you have to send all your files to an industry, pay them, and then they send it to you. There's a large downtrend in the time, okay? And before you're able to do surgery, the disease of the patient is already spread. But now, you have your X-ray taken, the same day you can 3D print it, and the following day the patient is scheduled for surgery. So we don't have any downtime. Okay? Now, what we want to espouse to most of our doctors is a DIY, do-it-yourself 3D printing, and we are now starting that. No? Most of the hospitals now, they have small 3D printers in their call rooms, in their offices, and they're 3D printing parts and pieces of the body of their patients before doing surgeries. Okay? So, biologic modeling is very good for orthopedics, which is my field. It is very well used by ENT and plastic surgery. Now, even neurosurgery, they can plan out their vascular surgeries. You can see the aneurysm even before you do surgery. For vascular surgery, you can plan how to treat the valve problems of your patient. You can even print the baby that you have. In Robinson's, I found out that they can print your baby even before they come out. Okay? And in general surgery, you can plan out the surgery very well. Look at this example. This is the brain on the on your left-hand corner, and the clear plastic is the tumor. Imagine, you are already holding the tumor in your hands even before the surgery the following day. The following day, with those models at hand, you will be able to plan out your surgery very well, knowing very well that once you have gotten to that area, you have removed all the tumors. Unlike before, you're not very sure as to the boundary of your tumors. This is another example wherein most of the surgeries that you can see nowadays, even in the Philippines, you will find a biologic model sterilized together with the patient because it becomes a very exact guide on how to provide surgery for your patients. So now when we do surgeries, these models are within our reach. Every time we do surgery, we grab the model, look at it, and see that we're doing the right surgery that we have planned days before doing the surgeries. Now, the utility of 3D printed models is very good for pre-operative evaluation, for surgical templating, which I will discuss in a short while, education of our patients. Sometimes it's very hard to convince patients to have surgery. Once they see the pathology in a 3D printed manner, they will agree with the surgery, and training, and then haptic preparation for our young doctors. Training young doctors is very difficult. Medicine is a long road, okay? So when we train young doctors, we give them a haptic preparation. What is a haptic preparation? It comes from the word haptikos, able to touch or grasp. No? It's related to manipulating objects using the sense of touch and perception, which prepares you very well for the procedure the following day. Okay, example, this is one patient that we operated 3 months ago. That is the image on the computer. We 3D printed it. It's an exact model of what we're going to do surgery. With that model, I told the residents, show me what you're going to do. How are you going to drill the bones on this patient? And this plastic model, this PLA model, can be machined. It can be cut. It can be drilled. It can be sawed. No? It can be chiseled in much the same way that we're going to do the procedure during surgery. And much more than that, we can do exact implant measurement of the implant that we're going to do. We can pre-cut the implants. We can contour the implants already before we place it, thus saving us good 15, 20, or 30 minutes intraoperatively. And mind you, time is of essence during surgery, because if you are able to cut your surgery by as much as 30 to 40 minutes, no, that decreases the chances of having infection in our patient. Okay? Now, with 3D printed models, we have case-specific model in our hand. We have a 1-to-1 ratio of the fine details of the pathology of the patient. It reveals all the anomalies. It's a very good education material such that our surgeons are very confident the following day when they do the surgery, because they already have felt what they're going to feel once they open up the skin of the patient. Okay? And then it's a very good training material and a very good surgical practice, which we are not able to do years before. I hope when I was a young resident, I was able to do that. I would have been a better doctor right now. Okay? Now, what is the next bar in medicine? Patient-specific instrumentation. Now let's see how these models are used for patient-specific instrumentation. Okay, what we want to do right now is to have a patient-tailored surgery. Meaning to say, not all kinds of surgery will fit everybody. It has to be tailored for the specific patient. How do we do that? By accurate biologic modeling, we're able to do precise surgical templates, such that when we do, for example, total knee replacement, what is provided to us are metal templates that comes from the industry. These are all based on Caucasian sizes, imposed on small Asian sizes. They're too big. Our cuts are not very good. So nowadays, we CT scan the patient, we do our own surgical templating, and then intraoperatively, we use those templates to be able to do precise cuts. And once we cut the bone cuts are very precise, such that when we put our implants, it fits the patients very well. So that is what we call case-specific surgical templating. Okay? Now, this is another example of a patient. The patient had an accident years before. Ngayon, pasyente coma. The patient is always teased in school. The patient has a very low morale. We told the family, it's okay, the patient is functional, but the family wants it to be corrected. So, correcting this is not very easy, because sometimes you correct it, it turns out worse. So, this is where you have to CT scan the patient, plan out the surgery very well, do surgical templating so that you can predict the result of the surgery. So, in this case, we surgical template the patient, okay, and then we did this, no? And finally, we did the surgery, and we were able to do very good correction, and the patient had a very good correction. Okay? Now, patient-specific instrumentation allowed complex surgeries to be performed. I would like to show you our first surgery in the country, done in March 2014, wherein we had a 9-year-old female with Down syndrome, with Mongolism, who during a sac race suddenly became paralyzed, because patients with Down syndrome, they have unsteady occipito-cervical junction. So practically the patient's head was detached from the bone, but it was held on by skin and muscles. Okay? So with that head dislocation of the spine, we had a spinal compression overneck that is causing the paralysis. So what we did was, we have to use 3D printing to see the child from paralysis and to be able to do surgery on a very immature, abnormal spine of the patient. So what we did is, we wanted to do this procedure by putting those implants over the spine and the head to fuse it. The problem is, putting those screws are very hard by itself already. And this patient, you can see that the corridors where we're going to put the screws are very small. So we 3D printed the patient, okay? 3D printed our bone sleeves, or our screw sleeves. And then we made this as our surgical template. And finally, before the surgery, we had the surgical templates for our patient. So intraoperatively, this is how we do it. No? You clean the bone, because this is, you have to take away all the soft tissues so that when you put the surgical template, it's going to fit snugly on the bone. So you can see that's already snugly there. Okay, that is over one of the bones, the C3. Okay, and then this is cervical 2. That's our template. We're trying to fit it to see if it's okay. And when we found out that everything was okay, that's the time that we have to drill. These are the two holes over there will be the entry point of our drills, okay? So here you can see it being placed there. And then we started drilling the bone so that we will be able to put our screws precisely on the exact corridor where we want it to be. Okay? Para makita nyo kung ano yung surgical templating, for you to have an idea. Okay? And then we were able to place all the implants already. And finally, this is the final outlook of the patients. The screws are placed on the head like that. We have fused it already. And this is the patient's screws, no? Exactly placed where we want it to be. We could have never done that without 3D printing, without 3D modeling, without surgical templating. Okay? And here you can see that the bone is already fused. You can see those bones that are traversing the skull and the vertebra now. Now, this patient has been around for the longest time, still playing and still very happy. The patients are very happy. This is the only daughter of an overseas contract worker family. And unfortunately, they married late, and their only child is a patient with a Mongolism. No? But their love for the patient pushed us into the barrier of using 3D printing firstly in the Philippines with this patient. Okay? Now, accurate biological modeling is also about rapid prototyping. This is another thing that we're doing in the country. No? You design an instrument in a computer and you come up with a prototype and then you bring it to a manufacturer to have it done. Okay? You can see how it works, you can modify it. No? This is another model that we did. One time I saw one of our residents drawing something in the paper. I said, "What are you doing?" And then he said, "I'm designing a ceramic." I said, "Okay, let's 3D print it." You know? And then we 3D printed it. And finally, we did material testing and found out that it was strong enough to be used on our patients. So we started using it on our patients. No? So this is the UP-PGH wrist external fixature. We have used this on 5 patients and their fracture healed very well. Okay? And this is another aqua device production which translated into an external fixature, the UP-PGH steel external fixature, which we used on 12 patients during the Yolanda tragedy in 2012. Okay? So you can see how 3D printing has saved the limbs of patients already. And this is just but a simple application of 3D printing. Okay? And now prosthetics orthotics. You have seen a lot of this. I'll just breeze to this. No? Prosthetic orthotics is something that we can use very well with 3D printing. Be it a temporary prosthesis or a permanent prosthesis. There are a lot of challenges, but the point is we have to continue practicing and tuning our models to be able to come up with better prosthesis, okay? And weight-bearing prosthesis. And finally, creating the perfect tissue organ. Okay? This is something that's not just in the Philippines, but I want to discuss it. No? We want to replace our tissue organ so that we won't have any donors. So that I will not ask my sister or my brother to give his kidney for me or anything like that. So what is the ideal tissue organ? No? The ideal tissue organ, they started 3D printing an artificial skin in 2014, an artificial bone in 2015, an artificial cartilage in 2016. I just want to show you, no? This is a simple 3 to 4 layer skin that we have 3D printed. It's already being used now. So it's there. It's not an imagination anymore, it's happening already, okay? This is an artificial 3D printed tricalcium hydroxyapatite, okay, an artificial bone. And then they have already manufactured artificial bone with different lattices according to the strength that you need. Okay? Now, they have already models of artificial cartilage, but this is not yet used. There's still a lot of issues about it, okay? But still very experimental are artificial blood vessels because you need specialized cells with specialized circulation with electrical stimulation and hormonal stimulation. That's the problem with the body. There are so many controls that you need to input. Electricity, hormones, and other autoregulations. No? So this is a multi-layered skin or blood vessel that they have already experimented on. But you see our blood vessels opens up and closes automatically. That is static. It's just a conduit. There has to be something there to control the opening up and closing of blood vessels. Okay? Because that is very important. Now, they have 3D printed microcircuits, and now they're incorporating it into these blood vessels. Imagine they already have a workable artificial heart that they're using on dogs and rabbits. As you can see, they're trying to create artificial ears that can hear already, that can be connected to your brainstem. And 3D printing architectural scaffold is something that will enhance stem cell technology in the future. Okay? So this is a scaffold where you put stem cell to create an artificial organ. This is an ear. You have a lattice framework. That's the skin, the framework. No? And now they have incorporated electrons into it in order to create a real bionic ear. And then they print it, no? They paint it to make it really look like. Okay? And last but not the least, artificial heart. No? And finally, tailored treatment modality, patapos na tayo. Last 3 minutes. As you can see, no two people are the same. Tailored treatment modality is very important. This I've shown you. And very often, this is the simplest thing that we take if we are sick. A pill, a tablet. Diba? Now, for most of you who are young, you take this when it's needed. But when you turn 50 like I am, no, you already have a maintenance drug like this. In my bag, I have a medical capsule like that. No? That is 50 to 60 years old. When you become 7 to 80, it becomes bigger. Mas marami na yan. Diba? Okay. So, sometimes you forget. It becomes a big problem. With 3D printing, probably we can make it simpler. Okay? How about combining all of this in a 3D printed solution? How about putting your core medicine and then shell coating it with substance that will degrade at different times, okay, according to the acidity of your stomach. And then you have a coating with programmable rupturing so that it will release at a specific time. So we are seeing the future wherein you don't have to have large pill boxes, wherein you will have one capsule like that you take in the morning, and that's it. It will release it automatically at noontime. It will release it automatically at lunchtime. It will release it automatically before you sleep. So you don't have to take so many drugs. You just take one small drug that will be released automatically in due time. Okay? So 3D printing is still nascent in medical utility. It's still primitive, but we're there. We're very much there already. Okay? Together with subtractive manufacturing, it becomes a potent tool. Let's not put aside subtractive manufacturing. Let's put it together to have something better. Okay? And then, 3D printing is a promising tool that can ensure patient safety and wellness amongst our patients, especially for us Filipino patients. Thank you very much.